Hi there and welcome. If you're dealing with chronic joint pain, skin inflammation, or autoimmune symptoms, chances are you've come across a medication called Enbrel. But what is it exactly? How does it work? And what makes it different from newer treatments? I'm Dr. Rezaian, a specialist in arthritis and autoimmune diseases, and in this video, we'll unpack everything you need to know about Enbrel, from how it works to who it helps, so you can feel more confident in your care. Before we begin, please remember, this video is for education and inspiration only. It's not medical advice. Always talk to your doctor before starting or stopping any medication. Let's start at the beginning. Enbrel is a biologic medication that helps quiet down an overactive immune system. In conditions like rheumatoid arthritis, psoriatic arthritis, and plaque psoriasis, your immune system mistakenly attacks your own body, causing inflammation, pain, and damage. Enbrel works by blocking a powerful immune chemical called TNF, or tumor necrosis factor. TNF acts like a megaphone for inflammation. When you take Enbrel, it helps turn that megaphone down, allowing your body to recover and feel more balanced. Enbrel is taken as a subcutaneous injection, usually once a week. You can give it to yourself at home using a pre-filled syringe or an auto-injector device called SureClick. Most people find it becomes routine quickly. And unlike some medications that require hospital visits for infusions, Enbrel gives you the freedom to treat yourself wherever you are. Enbrel is approved to treat a number of autoimmune conditions, including rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, plaque psoriasis, and juvenile arthritis in children as young as 2. It's one of the most broadly approved biologics on the market. When Enbrel works, it can be transformational. Many patients experience less joint pain and swelling, less morning stiffness, improved mobility and energy, and calmer skin if psoriasis is involved. For many, improvement begins within a few weeks. And in the long run, Enbrel may even help slow or prevent permanent joint damage. Here's an important point. Unlike some newer biologics that may cause more frequent immune reactions or lose effectiveness over time, Enbrel has one of the strongest long-term safety and tolerability records in its class. It's well-studied, generally well-tolerated, and less likely to trigger immune-related side effects compared to certain newer medications. That's part of why many doctors, including myself, still consider it a reliable first-line option. Most people do very well on Enbrel. The most common side effects are minor, like redness or itching where you give the injection. The biggest concern is that Enbrel slightly weakens your immune system, so it can make you more vulnerable to infections. Before starting, your doctor will check for things like tuberculosis and hepatitis and monitor your labs while you're on it. And remember, if you ever feel feverish, fatigued, or unwell, don't wait. Call your doctor. Enbrel has been on the market for more than 20 years, and we have a deep understanding of its safety over time. Many patients stay on it for years with excellent results and minimal side effects. Just be sure to stay consistent with your lab work and follow-up appointments to make sure your treatment stays safe and effective. Let's break it down simply. Pros: fast symptom relief, long history of safety and research, easy weekly at-home dosing, works well for both joint and skin issues, less immunogenicity than some newer biologics. Cons: weekly injections, may not work for everyone, requires routine monitoring, may be less effective for severe skin-only psoriasis compared to newer options. Still, for the right patient, Enbrel can be a game changer. If you're considering a biologic and want something tried, true, and trusted, Enbrel is absolutely worth a conversation with your doctor. It might not be the flashiest new option, but it has a track record of reliability that's hard to beat. And in the world of autoimmune disease, consistency and comfort matter. Thanks for tuning in. If you found this video helpful, give it a like, subscribe for more clear, friendly, and evidence-based medical explainers, and leave a comment below. Whether you're starting Enbrel, considering it, or already using it, I'd love to hear your story. Stay strong, stay informed, and I'll see you in the next one.